So, what is one thing I urge all women to consider after undergoing breast reconstruction? Once you've completed your journey and you're happy with the size and the shape, and you think, okay, I'm done, a lot of women have said to me, no, I don't think I need to do 3D tattooing. I don't need an areola or any nipple. And from what I've seen with women, is that you kind of feel like this new breast is a blank slate, and it's not really your breast until you look in the mirror and you see the nipple. And that's not true for all women. Some people are very happy with getting artistic tattoos over their scars, and I think that's all awesome. But I have seen a dramatic change in how women kind of feel whole again after they go through the 3D areola nipple tattooing process. And I totally recommend that. So, when do we start talking about nipple reconstruction during your journey to rebuild the breast? Usually, patients undergo two surgeries for breast reconstruction. The first is rebuilding the breast at the time of mastectomy, and the second is really just a refinement surgery. So, either placing a final implant, or if you had a deep flap or a thigh flap, refining the volume, doing some fat grafting to improve symmetry between the breasts. And at that second stage surgery, or what we call phase two, commonly that's the time that we would rebuild a nipple if that's what the patient wanted. There's two ways to do nipple reconstruction. The first is to build a nipple, which is a little projected piece of skin in the center of the new nipple. And then once you've fully healed from that, about 3 months later, we do specialized 3D tattooing with a very specialized, talented artist in town that can really tattoo the areola to be the coloration we want, the shadowing we want, so that when you look in the mirror as a patient, they really now feel like your breast because you see the nipple, which is how we identify our breasts. And so I think nipple reconstruction, even doing 3D tattooing and not the projected nipple, is so important to feeling whole after this whole journey. So why would some women decide to have a projected nipple and some women decide to have a flat nipple? I would say the majority of women, maybe about 90% in my practice, decide to just do 3D areola tattooing instead of a projected nipple. And the reason being is I would say the majority of women kind of enjoy the fact that they don't have to wear a padded bra, or they can wear a sheer top, or they don't even have to wear a bra after undergoing mastectomy and reconstruction. And if they were to get a projected nipple in the center, sometimes they feel like they would have to cover that up in clothing. So I think it's been the trend, definitely I've seen over the last 3 years, that the majority of my patients just prefer to do 3D tattooing.